Dansei, welcome to Soul Medicine Ancient Psychologies for Wellness. I am your host, Dr. Karlee Fellner, psychologist and member of the Métis Nation of Alberta. As always, feel free to pick up what fits for you and to leave what doesn't. I'm just here to present a different way of understanding mental health and wellness. This podcast is not intended to provide or take the place of professional advice. If you or someone you know is in need of mental health supports, please reach out to one of the many resources available in your area or to a trusted professional. Rebekah Dunlap is a member of the Fond du Lac Band of Lake Superior, Ojibwe, raised on the Fond du Lac Reservation. She began learning about birth as ceremony during her own pregnancy and continued that learning as a doula serving her tribal community. She later earned a doctorate in nursing practice with a specialty in midwifery to better navigate healthcare systems and bring Native perspectives into spaces where they are often missing. Rebekah enjoys consulting around pregnancy and birth as ceremony and supporting families in their birth process. She is always eager to connect and encourages folks to reach out to her. You can find Rebekah's contact information in the episode description below. I am so excited to have you with us today, Rebekah. Rebekah is a dear sister friend of mine, also from Minnesota, who I actually met in the context of preparing to birth my first baby. We'll probably get into that story a little bit, but I'm really excited to have this conversation today. Rebekah's been an incredible support to me throughout both of my pregnancies and birthing and also parenting and also just as a sister in spirit as well. So thank you so much for joining me today, Rebekah. I'll hand it over to you to introduce yourself.
Aw, miigwech, bonjour, meno ode ikwe, good-hearted woman. Wawaseamug, indigenous cause, wawajeshi dundame, nagachuanang, in Dunjaba, Rebekah Dunlap, Jaganashe Moen. My name in Ojibwe is the bright white lightning that lights up the sky. I am from the Martin clan, and I come from Nagachuanang or Fond du Lac, which is at the far end of Lake Superior. My English name is Rebekah, so you're welcome to call me Rebekah. And I've been doing birth work about 18 years because, well, maybe even close to 20. I started doing birth work about the time that I was pregnant. I started learning a little bit more about my culture and traditions. I didn't grow up with my culture and traditions so much, but I grew up on a reservation in Minnesota. And so it was around me. I had an uncle who was a medicine person. I have grandparents on my maternal side that were both boarding school survivors. And so there was that disconnection, right? And so there was a lot of like secretive stories and things like that we weren't allowed to be around. So there'd be times where we'd be shooed out of the kitchen if they were maybe making medicine on the stove, and I'd be curious what's going on, and they would just tell us to leave. And I grew up going to church, and that's what we were supposed to do, and that was very strict and serious. But as I aged and grew into an adult, I still was curious about things and wanted to know more. And I had this intuitive sense that it was not as negative as I was grown to believe, that those messages that were passed down from my grandparents to my mother to me, there had to be some sort of light and beauty in all of that. And I just knew that intuitively. And so I started to seek it out when I became pregnant and when I became a mom. And it was true. And as things unfolded, as I started to learn more and the knowledge grew, I was like, there it is. That's what's been missing in my life. And so when I became a mom, I knew that's what I wanted to fill inside my son and his cup and to raise him with. I just had this sense that with that culture and the traditions and the language and anything that I could provide, that it would protect him and it would help him grow into a solid person. And now he's 18, and I really do feel that way. I do feel like culture is protective in so many ways. And so I'm really grateful to be able to share a little bit today of what I've learned and our story and how we've connected. So thank you so much for having me.
I just realized this was not intentional. I have my Lake Superior mug.
Oh my gosh, that's amazing. I don't have a Lake Superior, but mine says you are enough.
I love that. Love
Yeah.
that. Oh, one of the things that came up for me as you were sharing that piece about culture, because I've been doing the work that I've been doing just over 15 years now. And coming from the perspective within psychology, looking at mental health, really
Yeah.
holistic wellness, culture is the heart of it. I remember there was an organization in Vancouver back when I was living there, Culture Saves Lives. And it's true. And I didn't think a lot about the significance of birth in that until I became pregnant myself, and it was like this moment of realization, which almost seems like a how didn't I consider that before? I'm doing all this work in community wellness, but it was like this light just came on that wellness, of course, begins at birth. Healthy communities begin at birth. And with how we are supporting not only the transition of that spirit from the stars into the physical world, but also how are we supporting the person who's birthing, both in the
Well,
process of birth and then very importantly in the time following birth. Because I don't need to tell you this, but it's an incredible spiritual transformation to birth,
mhm.
and you really do open up as like a portal to the universe, and just coming to realize myself how important it is, all of the ritual and all of the ceremony that's always surrounded that to ensure that the one who's birthing is kind of closed back up and brought
Yeah.
brought back into this physical place
Mm.
Euro-Western psychology loves to use, attachment. Those fundamental attachment relationships begin at that time, at
Yeah.
how the birth takes place, how things progress, how that immediate time afterward is cared for, and then also, the wraparound supports that we're meant to have around us in the postpartum time.
Yeah.
I'm always out there talking about these conversations that come through our bodies, right? That when something's getting the best of us, as Richard has taught me, Niji Mowen Mi Winja, something's getting the best of us, we need to call our helpers. That conversation for so many during the postpartum time is just letting us know we need our villages, right? We're meant to be a
Yeah.
community. We're meant to be cared for. There's so much
Mhm.
in the birth process that needs to be cared for as well, and
Yeah.
it's not just the baby, it's the one birthing and it's the family. And so I had a lot of realizations during my first pregnancy and then, moving through birth and becoming a parent about like, whoa, like the wellness of our communities, the wellness of our
Mhm.
cities, the wellness of humanity is so
Mm.
rooted in how we bring these little ones into the world.
Right. Yeah. Right. Goodness. Just when you mentioned, it starts at birth. I started thinking, gosh, some people will say it even starts at pregnancy. Oh, it even starts in adolescence. And then when we're teaching people about their reproductive systems and so forth. And then my thought goes back to like, oh my goodness, I'm talking about my grandmother being in boarding school and just thinking about that idea of she in her uterus was holding my mother and in there was holding me. It starts so far back, but we're making these changes and we're making ripple effects. We're reclaiming and revitalizing what we've always known that's been in our DNA and making those changes and breaking those generational chains. And so I just have to say how proud I am of, this new generation that is standing up and making change and who intuitively knows there's got to be a different way. And so I just hope that I can share a little bit of my story and maybe be a little bit of an inspiration or that people can come to me and say, how do we do this? How can we make some change? I want to make change together and, be part of the revolution, the pregnancy and birth revolution. Um, and I like what you said too earlier that it's not just about indigenous ways of knowing. There's all sorts of different ways of knowing within us, all different types of people that have ancestral blood knowledge within them that they carry as well and that they can put forward as well. My story is one story from an Ojibwe perspective, but there's all sorts of perspectives out there and blood memory. So I just encourage people to find time to seek their own knowledge as well and find their spaces, their sacred spaces to dream and take it in and visualize what ceremony means for them because it could mean so many different things for different people. And when I first became pregnant and was learning about these things, I remember having a relative come to me and she brought me this little leather pouch. And she said, there's a tradition, and I'll share this with all of you. She said, there's a tradition in our Ojibwe culture where when our baby's little belly button stump falls off, we put that in the pouch and that we keep that with our baby and we keep that near them throughout their lives. And they won't ever be lost. They won't be looking in things or running around lost and looking for their belly button. They'll always feel like they're connected. It's not just about the stump. It's like they're always going to feel like they're connected to their parent and to the Ojibwe culture and traditions and the land around them. And so she gifted me that and she said, now someday when he leaves, you give that pouch to him and you say, you always have a connection with me. And that was just like mind blowing to me. And I said, see, I knew that we had these beautiful traditions and I wanted to pull in more and I wanted to gift him with those messages and stories growing up as well. I think about what you were saying with the ancestors and the stars that come through us. And as a midwife, the first time I remember feeling a pulsating umbilical cord, it was like, ooh, that was almost so much too much power. I thought, I don't know what I'm touching right now. I don't know where this is coming from. And it just was like the most incredibly powerful moment. I almost felt like I shouldn't touch this umbilical cord. I could just almost feel like the stars and the ancestors and everything just coming through that placenta to the baby. So I just feel like our ancestors knew the power of that connection. Whew.
Yeah, I feel that one. I'm getting really emotional because it is
Yeah.
emotional to me. It's like this, like what an incredible ceremony birth is, right? The
Yeah.
transition, the two, I think of them as the two most powerful ceremonies, birth and death, that are
Mm.
so connected, so connected. And the episode I did with Kathy, I loved how she talked about the spirit sending the little ones in.
Yes.
Maybe there's a grieving process there, who knows, right?
Yeah.
They're
Mhm.
sending them off to come here, and then we go back there at some time, and these are the 2 most significant ceremonies, and that all humans experience. That's the thing, like you're saying, it's not culturally bound. This is real, and this is powerful, this is life, right? And when
Yeah.
I hear you talk about that cord, all I can think of is, like, the source of life, like, the great
Yeah.
mystery, literally the power of creation, of what created
Mm.
the universe is moving through that cord,
Yeah.
and this is so significant, and it's so meant to be honored, right? And
Right.
I just think about the collective grief around the way that the process of pregnancy, birthing, the postpartum period is sometimes treated within a conventional Euro West paradigm. Not always, right? That's why I say sometimes, but often the sacred is removed from it.
Right.
And we are seeing that collective shift, like you talk about, of people who are bringing babies into the world, and regardless of where they're from, where their ancestors are from, people are working to reclaim birth, right? And to bring birth
Yes.
back to the land, back to community. At the same time, I feel sad sometimes when I see people who feel that their only option is to free birth or something, right? Like,
Yeah.
feel like they can't,
Oh,
you don't have to do that, right? But I understand why they feel like they have to if they can't
right.
find those supports. And so it's just interesting being in the world that we're living in today, where birth was kind of co-opted into this system that treats pregnancy, birth, and the postpartum period as illness or as
Right.
medical emergencies, even when they aren't. Sometimes medical emergencies happen, but they also happen in everyday life, right?
Mhm.
It's no different than any other time of life. A medical emergency can happen when you're out for a walk.
Right.
It can happen, right? So it's just really interesting because I think there's a lot of grief around that when people don't
Mhm.
the aunties and when we're not able to honor that transformation that's taking place. Again, like I say, both the birther and the baby. There's a lot of focus on the baby. We can't
Right.
forget about the one that's giving birth.
Yes, exactly.
And we need to look after the one that's giving
Yes.
in order to look after the baby,
Exactly,
right?
exactly. Yes. Oh my gosh. And I was thinking about what you said about and how birthing in a hospital space and this clinical space, how yes, emergencies happen and a lot of people are like, well, I have to go to the hospital because that's where I'll be the safest. But what I've seen, and there's even studies that show it, is that things happen in the hospital setting that can set you up for an emergency, that set you up for postpartum hemorrhage and things like that. And so I always encourage people to get to know themselves and their bodies and to listen to themselves. And and you'll know what you're feeling, and you don't need to be told how to birth and what to do and what sort of medication you should have and how your baby's doing. You'll know all these things. You'll feel baby moving. You'll have a sense. And so really tuning in. And yeah, there are a lot of things that can happen in the hospital that can be really scary for people. And that westernized mind, that way of thinking takes over in that space. And I've seen even just thinking about that the cord and the life-giving placenta and it just being removed and put in a bio bag and being sent off. And one time I started thinking about the placenta, right? Like, how amazing is this organ? Because I'm like looking at this baby and how did this baby survive? And there's this blood circulating and pulsating through this baby and to what? And to this organ, this amazing organ that our ancestors intuitively knew to honor, to uphold with respect, and to put back out to the earth instead of just getting rid of it. And what beautiful way of going about things to honor this organ that's only created during pregnancy. It's the only organ we will ever create, and then you can just get rid of it. It's no longer needed. But it provided nutrients for your baby, filtered things so your baby would be safe. It gave it what it needed and took away what it did not need. And I mean, it just did such a beautiful job. And then to be able to honor it in that good way, we often will put it by a tree and we'll look at that tree and say, oh, that's a big, strong, great looking tree. That's the kind of life I envision for my child. I'm going to put the placenta there, or I'm going to put the placenta by this body of water or in this certain special place where my family, for example, grows trees, maple trees, and harvests every year, finding a sacred space for that placenta. I think that's so important and it's so grounding for that child. And we say over here that wherever we bury that placenta or we hang that placenta, your child will always want to come back to that area. They'll always know they have a space. And so it doesn't have to be a home where, like, oh, you want them to come back there all the time, but just a space, a grounding space for them. Like, I always want them to feel close to the lake. I'm going to bury it by the lake. I always want him to feel close to the tree of life, the maple tree. I'm gonna bury it somewhere by the maple woods, somewhere special to honor that organ that did so much for your child, but also space to ground your child. Connection is so important, right, Carly? I think about your work too and how important that is, and not just to throw it away and to create that sense of disconnect. I think that's where a lot of the troubles that we see in our families come from is that disconnect and that lack of security.
Exactly. And yeah, and I was thinking it's funny you mentioned the maple tree as the tree of life. And I always think of the placenta as the tree of life, right?
Oh,
It's because you look at
right?
it, and that's what it is. And so it's interesting because you see across cultures, you see across spiritual traditions globally, this tree of life. And it's really interesting how, in a contemporary sort of colonized kind of mindset, we think of these things as metaphors or as myths or legends or
Yeah, yeah,
whatever. But it's like, no, like this is real. And
yes,
this is the tree of life, right?
yeah, yeah,
And then how beautiful, just to speak of it that way, even you're talking about the tall tree and having that tree of life there, nurturing that tree, right? But it is,
mhm,
like you say, that fundamental connection. And I think for a lot of us, especially kind of in our generation, when the hospitalization or medicalization of birth was kind of at a peak, when we were coming
right,
to the world, a lot of us did our
mhm,
and our umbilical cords, our belly buttons just ended up in a garbage pile somewhere, right? You think about that, like, I get emotional thinking
mhm,
that because I look around at the world and it's like, no wonder we're struggling so much.
yeah, mhm,
Right? And it's
mhm,
almost I really do believe in the power of reclamation and repair, and even you talked about your son's umbilical cord always being his connection to who he is, as an Ojibwe
mm,
man. And so I think of my own belly button, right, which who knows where it
yeah,
ever, but how I've metaphysically had to recreate that through
mhm,
working to
yeah,
connect with who I am, as a
mhm, mhm,
Inyo an indigenous woman. And so, yeah, I really believe strongly in the power of these rituals around bringing life in, also
mhm,
around honoring life when life is leaving as well. All of those rituals are so important in keeping us balanced and keeping us well.
mhm,
And so I think it's important no matter where or how people are birthing, for people to know that you have a right to that placenta. You
yes,
know?
that is so true.
Yeah. And how we're at a time where we just really need to become advocates when we are in those spaces, right? It's good to see a lot more birthing centers and kind of opportunities for people to birth in environments that treat birth as the sacred ceremony
Yeah,
that it is, even if it's
right,
being referred to in that way, but a space that's calming, that's grounding. I
mm,
never could make sense of birth taking place in facilities where people are sick and dying.
right, yeah,
It doesn't make a lot of sense, and even
mhm,
cultural teachings, we're not actually meant to be around
right,
people who
yeah,
are dying when we are bringing
mhm,
life in. So you think about that and the impact
yeah,
that has, and so I'm glad to see those other opportunities arising, as well as a lot more people kind of reclaiming, birthing in the home or even on the land for some of us.
yes, yes, yeah, yeah,
Uh, and as you know, I was very stubborn about making that happen for myself. Uh, and as I heard you talking about trusting your body, that's where it's at, right? Because I know people who had real medical emergencies naturally take place during
mhm,
their process of birthing, and they knew, they had a feeling,
yeah,
right? Something's not right. You hear that every single time.
mhm, yeah,
And the beautiful thing is you can get that support. I mean, that's even when you're birthing at home,
yeah,
you're birthing on the land,
mhm,
midwife there, your clinician there, they
Yeah,
know how to
they
recognize,
do. Yep. Mhm.
right?
Yeah, and they know early, and generally people know early enough too in order to get somewhere where they can get support. And I think that people don't often understand that, and they think, "Oh, I need to be at this facility where all the equipment and the big wigs are who know what to do." And so, yeah, so really knowing yourself and your baby and just being really in tune to what's going on with your body, even just like they're gonna listen to my baby with that monitor. Wait, what if I asked them to do it myself? Where would I find the heart rate? And what does it sound like? And how many beats? And, just really being in tune and advocating to be central in those spaces and asking for your care to be centralized too, I think is really important. But there's ways too. When I was a doula, I would oftentimes be in the hospital setting. That just is how it worked in my program that I was in at the time, and with the contract that the tribal clinic had with one of the local hospitals. So a lot of my clientele would often be at the hospital. And I started to find little ways that I could protect that space because you're right. You are in a space where there's so much happening. And I would even find ways to protect myself, whether it was wearing a crystal or putting cedar in my shoes, smudging before and after I left, and advocating to smudge inside the facilities. And eventually it worked. And so sometimes you just have to take those little baby steps and nudge your way towards advocating for your needs and for the needs of their clients. But yeah, so there are things that you can do when you're in those spaces or in any space really to create a sacred space for yourself. And I would say for us as Ojibwe people in this community, using our four sacred medicines, so our tobacco, our sweet grass, our cedar, and our sage, and using those in any little way that you can. I would start to take dried cedar and I'd crush it up in my hands and I'd put little pieces of powder in front of the doorway to like create that space and that barrier to whatever is outside of that door. It's like you said, there's people that are sick and people that are dying, and there's all kinds of spiritual activity in those spaces. And so, really important to make sure that there's some sort of barrier created, even singing songs or putting a little, I would take like a little tissue or something and put tobacco in there and put it next to the head of the bed of the person that was laboring, even bringing medicines and putting it maybe in the shower or in the bath or just around the space. So there are ways that you can create a safe space for you. If prayer is important to you, and if that means smoking something and the facility won't allow you to, maybe somebody outside of the facility could do it for you, but also advocating and making comments. There's comment cards or letters you can send afterwards to give your feedback, and I promise it does make a difference over time. There are people that work within those facilities that also want to help and make change as well. But yeah, and even our sacred fires too. You may not be able to have that in the hospital, but perhaps somebody at home could light a candle for you or have their own sacred fire. Here in the States and Ojibwe community, we have fires that help guide the spirit when they're leaving and when they're coming here. But oftentimes we forget about those ones coming here. But we are trying to revitalize that practice around lighting the way for the little one. And oftentimes that was the male's role, was to start that fire and to keep that fire and light the way for the child coming in. And then the person that was laboring would have their more feminine energy around them. And so everybody kind of had their role, and it's about balance, not about who is right or wrong or better or stronger, or anything like that, but really about finding balance, just like you were referring to earlier, having that balance. So important.
Yeah. Oh my god. I'm just like, you're taking me back to my birth pita because I got
Oh,
to have
yes.
the fire and to also be surrounded by the feminine energies in the lodge. And I do want to say, because it feels important that From a medical perspective, and you know this, you were there with me. I had really high blood pressure, and I had, especially with my second baby, what would be considered kind of numerous risk factors, borderline high risk birth. But I think it's so important to really have a critical perspective about some of that, to know that that's coming from one worldview,
Yeah.
which we talk about in every episode of the podcast, really. We're just talking about it in different topics. But it's really important to acknowledge that within the Euro-Western medical system as well, it's one worldview that functions in one type of reality. And that
Mhm.
particular reality that it works in is, from a philosophical perspective, would be called positivism, right? That's the philosophy of science, that for something to be real, it needs to be observable, measurable, all these things. The metaphysical world does not exist in Euro Western conventional medical,
Mhm.
right? Of course, you have doctors who work in more holistic ways, but generally, the philosophy of science there is positivism. So you have this one worldview that looks at things in terms of numbers, measurements, all of this stuff, and it's only one way. And it is reductionist, that it's about reducing things and, trying to problem solve A with the solution for A.
Yeah.
And like,
Mhm.
and so it's missing all this other context and the holistic picture, right?
Mhm.
Look at blood pressure as a number, and at the end of the day, it's also just a number. And so my challenge with my second one was truly leaning into the teachings and living what I knew was true, and trusting, again, it's we've already been talking about it a few times, but trusting what my body knew. And my body knew that my baby and I were going to be fine.
Yeah.
My body knew I can birth in that lodge and we are gonna be okay, and we're actually gonna be a lot better in our case than if we went into a facility, which, as you know, was my experience with my first. I think being a first time birthing person, I mean, first off, I was really naive too, because my body was telling me, Carly, you don't need to go in. You're good.
Mhm.
Baby's good. But then I'm being told by a service provider, you better go in. And I was very naive, thinking, well, maybe I can just go in to kind of make the service provider happy and then I can leave. I didn't realize the cascade and sequence of events that would take place once I stepped
Mm.
doors.
Mhm.
And it was actually really a fascinating experience for me to
Yeah.
realize how much my body went into trauma response of like, "Oh, I'm not allowed to leave here," as if I was a prisoner, when really, had I realized in that moment I can turn around and walk out, I would've. And baby and I would have been totally fine, and I know that.
Yeah.
And we would have been a lot better off, honestly. It like you say, the studies are out there, the research is out there, awesome podcasts like Evidence-Based Birth, all of this stuff is out there to say, like, there's statistics they show, and my personal experience, I was one of those people that received unnecessary medical interventions that created additional complications that wouldn't have happened,
Mhm.
and that then created an experience, incredibly traumatic experience, that as somebody who specializes in trauma, that's what I do.
Yeah.
I work with trauma. Even for me, with all the resources, with all the trauma supports, with all the cultural ceremonial supports, moving through and working through that trauma was very, very hard. For me, it took at least 2 years
Mm.
before I felt that I was out of trauma, and I was doing all the
Yeah.
things. But at the end of the day, when your body and your spirit are in that active response, it's like you just have to honor the process of moving through
Yeah.
that. And having had that traumatic experience unnecessarily, and then, another birth experience where, again, in this other birth, from a medical perspective, I would have been considered a lot higher risk, but had a provider who was willing to say, okay, yeah, I will listen to you, right?
Mhm. Mhm.
If you want me to put patient declined, I'll put patient declined. That's what I told her. I was like, "You put patient declined in there, right?" And I remember coming to that moment because Pita was born, at 42 weeks and 6 days, 1 day shy of 43. And those last 2 weeks, because I was in a process as you know, in and out of labor for 16 days. And it really challenged me. It really, really, really pushed me to faith,
Mm,
to surrender and to have faith and to live the teachings that I've learned and really lean into my medicines, right?
yeah.
And I remember just being like, okay, I need to stop worrying about my blood pressure. I need to stop checking it.
Mm,
My midwife,
yeah.
of course, is doing her due diligence. Well, you should check it. I know I should, but just say the patient declined. Again, I'm trusting my body, right?
Mhm.
And there are people who might consider that to be irresponsible. But again, when you're coming from a perspective where you understand the whole metaphysical side,
Yeah.
the spiritual side, the profound relationship that the birthing person has with that little spirit that's coming in, like there is a
Yeah.
whole other level of intuition, if we want to call it that, right? It's spiritual knowledge. You know if you're okay, you know if you're not okay.
Yes.
And so I really had to lean into that and really lean into the teachings of our ceremonies, right? I have Sundance and I kept going back to Sundance, right? That everything in the Sundance ceremony defies Western medical convention, right?
Mhm.
Just even the aspect of going without water for 4 days, we're supposed to be
Mm,
dying at that point, right? But
mm,
also know that there are people with diabetes, with heart conditions, with all sorts of different health complications who participate in this ceremony, who
yeah.
don't eat and don't drink for 4 days. And I kept going back to Sundance. That's what I had to keep going back to.
Mm,
That reminder to me, it was decolonizing my own mindset
yeah.
that the Euro-Western medical system is only seeing things in this one way, right? It's like I've mentioned this in other episodes of the podcast, right? It's the same as when people get a diagnosis of cancer, for instance, and they're told you're palliative, right? Like it's sorry, stage 5, it's gonna take your life. In that system, yeah, that is true. They can't do anything to help you.
Mhm. Mhm.
The world, they know those numbers, they know that's it. They only
Yeah.
have a certain schedule. But when you step out of that, I've seen many people healed in ceremony that
Mm,
were told that they were gonna pass away, and then they end up making a full recovery, right? So
yeah.
I think it's really important for people to remember that as well. That's just one worldview, it's one perspective, and really trust your body and you'll know and have your supports there who will help you
Right.
too, right? I knew I was in great hands. I knew I had an excellent midwife.
Yeah.
That if something did come up, she'd be like, "Okay, Karlee, we need to do something right now." I knew.
Yes.
And I would know too and be like, "Okay." And so having that trust there, and I just want to say it's absolutely so worth it because that birth experience I had with the fire, with the lodge, uh, birthing my baby on the land and knowing that she came in, her first sights and her first smells were the fire in the lodge. It was the earth.
Mhm.
Her first sight was the top of that lodge. I remember getting a picture of the teepee poles reflecting in her eyeball
Yeah.
and just being, like, overwhelmed, like, what an incredible way to come into this planet.
Right?
Yes, and then I got to be there with her in that lodge
Mhm.
for hours, Just what a incredible experience and what a different experience, and
Yeah.
my goodness, let me tell you, the postpartum period after that birth couldn't have been more different than the one
Wow.
where I was in active trauma, right?
Mhm.
And my son and I, my firstborn,
Mhm.
we had to do so much work. I know he was just a baby, but he was doing it too.
Yes, he was.
To even work on our relationship, our connection, our
Yeah.
attachment because of
Right.
some of the ruptures that took place in those early days due to the way that the medical system was treating it and putting him in a little thing away from me and all things that didn't need to happen. And then it's just extra work to come back
Yeah.
from that. I'm a firm believer nothing's beyond repair and healing, and so I know that we were able to come out of that, and I don't think that it impacts either of us anymore really, other than,
Mm,
the trauma wisdom we carry and how that'll come through at different times, but yeah, like, this is powerful, powerful work.
yeah. It really is. And just listening to your story, I was thinking earlier about why some reasons people might choose to birth on the land and birth in a different setting. And some of your listeners might even want to know. So, what's the big deal? Why pregnancy, birth as ceremony? What does that even mean? And so, and yeah, and I think it can mean so many different things to different people. But really, too, if there are people out there that are listening and they're providers that are providing care for people in pregnancy and birth, I just think it's so important to lean in and to check in with the people that you're caring for and to learn about what is important to them. And then to really try your best to be the advocate in that space to honor their wishes and so that we can stop that cycle of trauma that people experience and that disconnect that they're experiencing with their child as they're trying to heal and their bodies are reacclimating and everything, and like, who do they want to have in this space and how can we honor that as well? What can we do to help kind of bring them in and close them back in, right? Because, like you said earlier, our bodies and our spirits are just so open and so vulnerable. We need to take time to draw them back in. And one way that I've practiced that is to have people call their names out. When I first came on, I introduced myself with my Ojibwe name and my English name. And there have been times where I've seen people where they're kind of in between that space between here and the other side. And so I've told them, call your name in, say your name a couple times until I can see that they're drawing themselves back in because we need you, your baby needs you. But it's such a kind of a tipping point, and we really need to be watching people during that time and making sure that they're coming back into their body because also very exhilarating experience, and it can be easy to kind of float out here. And then it's such a shocking experience too. Sometimes I would even bring a blanket and wrap them in a blanket. And so their bodies can feel that and their spirit and their body can kind of draw back in and reconnect. And even having baby right there too, right? Because sometimes you can forget, like, wait, what was I doing? Okay, oh, I have a baby here all of a sudden. Oh my gosh, that all just happened so quickly and I can't believe that. It's like you go in this animalistic brain and you don't even know what's happening anymore. Yeah, which is very fascinating. But yeah, so it's so, I love that you were able to have that experience and gratification the second time. And what an empowering experience to say, I'm going to do this differently this time and I'm going to listen to myself and I'm going to honor what I think is best for me and my child and my body and my spirit. And so I would just encourage your listeners too to really do that no matter what that looks like for you, is to create that and to have the people around you that are safe people and really knowing this person is a safe person. They're really going to stand up for me and honor me and my wishes. It's so important to get safe people around you that are using safe, positive language too. I really want to encourage people not to use negative stories and share your trauma. Oh, I had this horrible experience. Oh, they put me on this medication. That was the worst birth I ever had. Or I bled so much, or, all these painful experiences. There's a lot of beauty in all of this too. And if you can find that, try to say something positive, but keeping that energy alive and beautiful and positive for them because those are the messages that they're going to be thinking of that are landing on them too when they're going through that message. And I just really want to encourage people. I always try to encourage them to keep the messages positive and the people that you're around, remind them of that and maybe even stop them if they start telling you their trauma and trauma dumping on you. So it's so important to keep our spirits energized and encouraged and just knowing that you have this, you know, and your spirit knows, your ancestors know they've done it before too, and they're all with you. They're
Yeah.
all with you.
Yeah.
And just even brings me back to how we met and that knowledge that came to you. And I would love to hear your story about how you came to paint that painting that eventually came to me during the time when we were all in the pandemic and I was, what am I going to do with myself? And started building the birth lodge. And saw your painting came to me through a couple people. And I was like, my goodness, they're speaking to us. Oh,
I know. Well, and it's interesting because, like I mentioned earlier, I didn't actually think about birth that much before I got pregnant the first time. And I mean, except in passing as sort of this, well, to be honest, let me just put this out there first. Growing up, I had an absolute terror of birth because of media,
yeah.
right?
Oh, yeah.
And again, kind of being in a more colonized way of thinking and paradigm, seeing birth in movies and on TV and all these things,
Yeah.
uh, and just being really, really scared of it. Like, I
Mhm.
don't know if I ever shared this with you, but it's sort of funny to think about if you could believe it or not. I was one of those people that, like, probably in my 20s was like, "Oh, if I ever have a baby, I'm getting a planned C-section." Like, a little unbelievable probably, but that's the power of that conditioning, right?
Yeah.
We're in this society where unless we have experience with or exposure to those counter stories, the counter narratives of physiological
Mhm.
birth, of that reminder of, oh yeah, wait a second. Our ancestors, if we go back to like Australopithecus, what's millions of years of like we have millions of years of experience birthing, and birth was always on land, always in community, and you'll see those people out there, social media or whatever. Oh, well, but people were always dying giving birth back then or whatever. And it's like people are still dying in hospitals today giving. Look at the stats.
The stats are horrible. I mean, in the States, yeah.
Yeah, yeah. And the statistics actually do speak to home births being more incident free, right?
Mhm.
And not having as much of that. So, anyway, people can look up the research on their own, but it's just interesting to see how much that programming has an impact on us, or again, seeing these images over and over. I still can't Now that I know what I know, I still can't make sense of how you still have doctors, obstetricians, medical residents today putting people on their backs to birth when there's all of the evidence, even within, again, Euro-Western science, saying this is actually like the worst position to birth in.
Yeah.
And the only reason it was started was to be convenient for the male
Mhm.
to decide. It's just, this is why I say it's really important for people to kind of question and think about that. But anyway, I did a little sidebar there. I do want to acknowledge that there are moms and babies who survive today because of Euro Western emergency medicine. I always say this is a funny metaphor to use here, but not to throw the baby out with the bathwater, right? Emergency medicine is incredible. It truly is. And there were, moms and babies that would have passed away that don't today because of those advances in emergency medicine. And so I just want to be really clear that that is really important, right? I think it's just important to know that distinction between something that's a true emergency, a natural emergency, versus a lot of what happens during birth that are actually emergencies that are created through intervention, unfortunately.
Mhm.
Back on track. So yeah, I hadn't really thought too much about birthing for quite a while until I became pregnant. And by the time I was pregnant, at that point, I was now very connected into ceremony and the culture and very much actively decolonizing my ways of thinking and knowing and doing. And so I was no longer in a place where I would really want to consider a medicalized birth. So I'm thinking, okay, I'll probably do a home birth. At the time, I was living in a condo in Calgary and was like, "Oh, that'll be interesting for my neighbors, maybe." Condo building. But then I had a dream. I had a dream
Yeah.
that I birthed my baby in a teepee in the water. And I also had a dream that he was a boy, which I found out he
Aw.
was when he was born. But yeah, I had that dream, and so it was really interesting because that was in the first trimester of my pregnancy. And I remember talking to the midwife that I had with my
Mm.
first and being like, so I just remember feeling weird about it myself. Like, would you ever support a birth like in a teepee on the land? I just remember in the moment even feeling like, is this even a thing? Again, I was so in my own
Yeah.
world of not paying attention to what was happening in the birth world. But I know that there people do have birth lodges, like yourself, and which I'm excited to hear more about too. But yeah, so and then she was like, "Well, I can't see why not." How it wasn't really anything they'd done before, but they were open to it, right? And
Oh,
so the painting that I did, I actually painted that in the last month of my pregnancy. I was ultra super pregnant, and I remember that I actually did that painting because I was feeling some of that pressure from the Euro Western perspective, the fear-based perspective, where it
oh,
felt like what I know that I'm meant to do, what I've been shown through the
yeah,
dream and this vision is at risk. I could feel the pressure, to move away from birthing on the land and in the lodge. And so I did the painting to just root me more solidly into that dream
yeah,
come to me. And so, I painted it there birthing on the land and with it was Maria Morin McCoy who had shared with me, the teachings about the old woman who pours the water through the Big Dipper and helps that little spirit to transition into their physical body and come earthside. And so I painted that. I painted that dream. I
mm,
painted my birth plan just to help myself
yeah,
in manifesting that at the time and which eventually I did. It was just, not with that particular birth, but yeah, that was the painting that brought us together at the very end of my pregnancy.
yeah,
And had I known you sooner, I know I before, "Oh, everything happens the way it's meant to happen," so I
right.
that, but there was this sort of like, "Oh, had I known Rebekah sooner, I think I would have had the tools and resources to
Oh,
just to remain on the path that spirit had showed me rather than kind of lapsing into that fear-based
mhm.
Western trajectory."
Yeah, right. Yeah, who knows, right, Carly? Because maybe that path was a gift to you so that you could see and so that you could do what you're doing now and create some sort of change because you had that experience. And I
Yeah.
love how you turned that around as well. And that you recreated afterwards. You had your hospital birth and then you recreated what you would have done.
Hi, hi. Thank you for listening to Soul Medicine today. Please join us on the new moon for part 2 of my conversation with Rebekah on birth as ceremony. How do we lean into sacred wisdom and reclaim birth experiences?